Hi guys, welcome to Shopping with Cheryl. Today we are I'm having a video. I guess am sharing a video with you that is a little bit different than my normal. Here's a product. Here's what I think of it. Here's the measurements. We're doing something special today that is near and dear to my heart because it has made it has affected my life and it affects the lives of a lot of people. It's a rare disorder, but it's called trigeminal neuralgia. And I even have the guys over at Magnet Me Up made me a magnet just for this. So October 7th is Trigeminal Neuralgia Awareness Day. And because it has played a part in my life, I want to share that with you, bring a little awareness, show a little support for my fellow warriors out there that maybe are still suffering with this. I am not a doctor. So what I'm going to tell you is my experience. It is not everybody's experience. There's different causes for it. Mine happened to be a cause that I had surgery for and could fix. That's not the case for everybody. Some people are still dealing with this for years and years and years and may only be able to treat it with medication. Luckily, for now, I've had surgery and I'm doing good. But trigeminal neuralgia is a facial nerve disorder. You have a nerve that comes out approximately, like I said, I'm not a surgeon or a doctor. It comes out of your brain and comes across and covers half your face. And it's called trigeminal because that nerve splits. It goes up, it goes across, and then down. I'm not sure. It covers half your face, okay? I developed this during COVID, which was just not good because what it is anything could touch my face. And as I said, this is my experience. Anything could touch my face, be in the shower, a drop of water, touch my face, send me into a flare. A hair could touch my face. The wind could blow. I could try to eat. Something would set it off. It could be anything. The barometric pressure played a huge role in it. So anytime the barometric pressure changed, I could go into a flare. And I lived with constant pain. That my constant pain was a lot of times it would feel like somebody had a good sized needle poked in. Then I had burning around my eye. Around my mouth here would feel like it was on fire. And most days it felt like somebody was trying to pry my teeth out of my jaws. Now that was just the normal that you kind of get used to. But what a flare is that would be set off by any number of these things is when I went to the ER, I had no idea what was going on with me. After about 3 weeks of severe pain, I was like, I have to go to the ER. I couldn't take it anymore. And there's a reason this disorder has the nickname it does, and I can't say it on here, or YouTube will flag me, Facebook, anywhere would flag me for what it's called. But a lot of people take their own lives to make the pain end. I explained it to the doctor at the ER. It felt like someone took an ice pick, connected it to a car battery, and jabbed it in my ear. At the same time, the only thing I could think of was eagle talons scraping across my face, and my face was on fire. And that was something that anything could set it off. Like I said, touching it. So during COVID, and they said, oh, you had to wear a mask. Absolutely not. I got so sick of these people who said, wearing a mask doesn't hurt. Well, actually it does for some of us. Anything touching our face could hurt some of us. It can happen to either side. Mine happened to be over here on the right. It was debilitating for me. I never knew when it was going to flare up, set off. But at the ER, thankfully, I got so lucky. So many people live with this disorder and never get a good diagnosis. Dentists want to pull teeth, or they say a sinus infection, or they have all kinds of things, but it's actually trigeminal neuralgia sometimes. So I got lucky. And the first doctor I ever mentioned this to at the ER, he comes back and he says, "Do you know what trigeminal neuralgia is?" And I looked at him and I said, "No. But how do I stop it? If that's what I have, how do I stop it?" He gave me a prescription. It just so happened that I had a reaction to that prescription, and my sodium level dropped so low they were going to admit me in the ER, but I just started taking sodium pills. That's a whole nother story. Don't go by my this is what I had to do. This doesn't apply to anyone else. Talk to your neurologist, your doctors, before you take any of those kind of steps. But I did go to a neurologist, my neurologist office. I happened to see approximately 5 different neurologists. Each time you went in, you never knew who you were going to see, which caused an issue. Some of them knew nothing, absolutely nothing about trigeminal neuralgia. They would come in and they would read to me. They'd ask me what pain I was having. And when I'd tell them, they would read back to me what Google says. I'd looked it up enough and done enough research, read back to me what Google said and said, "Well, that's not the symptoms." I said, yes, it is. Google will tell you that the stabbing in the ear and the scraping across the face and the fire and the whole bit and the nail here and the railroad tie here getting pounded, that only lasts for a second. Well, yeah, it lasts for a second, and I could have a flare that lasted a week or two until I could get back and get a certain type of medication that would help tame that down after a few days. But I was constantly on medication that was not good. It helped probably cut the flares down. I took 2 types of medication. The medication had me at the point to where I couldn't hardly even remember how to spell my name. I had to constantly watch my sodium. They constantly did checks for kidney and liver damage because of the medications. I did my own research and found out what I really needed to do was see a neurosurgeon to see if we could do surgery and fix this. Because in my case, mine was caused because if this is the nerve, I had a blood vessel touching that nerve, and every time my heart beat, it's rubbing on that nerve. And so it just had all the myelin worn off. It was just a mess. And as I say, this is my experience. I'm not a doctor. And so they made a nice cut in my skull, drilled a hole in my head. You know the old saying, you need that like you need a hole in your head? I got a hole in my head. They patched it, I think. But they went in there and put a cushion in between that blood vessel in the nerve. So it's let the nerve heal instead of just constantly pushing on it. Because if my stress level went up, my heart beat faster, which means it rubbed on that nerve more. If I moved around a lot, got my heart beat up, like I said, anything touch your face. Normally, you may not feel a hair touch your face, but when your nerve is that wired up, anything would set it off. And when you have a facial nerve disorder that goes straight to your brain, there are no stop gaps. If you have a nerve in your hand or somewhere else, they have little stop gaps, is the way it was explained. But anywho, I went to a neurosurgeon. They did the surgery. I have been doing good since. I have numbness. It's been over 3 years. I still have a lot of numbness in my face. I can tell when my blood pressure gets up, when I'm tired, different things. I will still get numbness. I don't care. I don't care about the numbness. I'm just so happy the pain is not there. The pain would be so much that I would lay on the couch or in bed because I wanted to keep my head up to try to keep the blood pressure down. I would lay there and I couldn't scream because that hurt. I couldn't cry because I didn't want water, the tear running down my face. You just lay there and you breathe and hope it doesn't get worse. You just sit and hope it just goes away. So I wanted to bring this to you that yes, trigeminal neuralgia, if you've never heard of it, you can look it up. You may know someone with it. It seems to happen a lot to women after 50, which would be me. The blood vessel, I don't know how long it's been there, but I hope it just likes staying over where it's at and I don't get another one, because not all microvascular depression surgeries work. Not all of them last forever. So far, so good. But I did want to give a big shout out to Magnet Me Up so that I can support my fellow warriors. Let them know we need to get this out there. And I know there have been a few shows, I think it was Chicago Hope or something like that, had a little blurb about it, which was really depressing because the blurb they had on their show was so far away from what most of us deal with. There are people that have this disease and their neurologist won't even send them to a neurosurgeon. They say, oh, I don't see anything on the MRI, so you're good. They don't even try to help. So the show that they did where the girl went into the emergency room and they did the surgery the same day, that's not how it works. But maybe for somebody on TV, but not in real life. We've also had some celebrities that have come out with it. I don't know what theirs is caused from, because there are other causes like shingles and things like that that can cause the nerve damage. I don't know if any of them have had surgeries, how much medication, what kind of flares they have. Some people just have the constant pain and don't have the extreme flare. Some people just go for an extended period of time and have an extreme flare, then it goes away and they're good. Mine happened to be a constant every day, and at least once every couple weeks, I would have not just a regular flare that would come and I could calm down and get it to subside. I would have them where the flare would last up to a week before I could get into the neurologist, and they would give me a certain type of medicine that would help break it down and clear it out until the next one. But very debilitating. Working on a schedule was pretty much out because I didn't know what would cause the flare, when the flare would come. Like I said, stress really affected mine a lot. Even going out to do anything, I didn't want to go. I was terrified to go anywhere, afraid it was going to hit. And if I'm out, how am I going to get home? Because when it would hit, I couldn't drive. I couldn't do anything with the pain. I couldn't function. So that was another part of it. And so if you know someone who has been diagnosed with trigeminal neuralgia and you look at them and you say, you look fine, it's a headache, it's a toothache, oh, it's just an earache. No, it's not. And I'm going to say it blunt right now. It is not. I've given birth to 3 children, natural childbirth. I've broken bones. I've done all kinds of stuff. And let me tell you what, it is not a headache. It is not an earache. It is not just like having sinus inflammation. It is a pain that is unimaginable. And if someone else were to have come to me and said, I have trigeminal neuralgia and this is what it feels like, I wouldn't have understood. And I get that. It's unfreaking believable. And for them, somebody to say, well, what'd you do? Or what'd you eat? Or what? We don't always know. We don't always know. And like I said, everybody's case is different. I'm telling you from mine, I didn't always know. It could have been a hair just brushed across my face. Anything could set it off. The barometric pressure, like I said, you can't see it. And to look at me, I could have been in excruciating pain. And unless you could see that I was not speaking, I was not blinking, I was not doing anything, you can't see my face contorting or doing anything. It was just an extreme pain. So I had a friend that would call me all the time, how's your face? And I used to tell him, my face hurts me worse than it hurts you, which is something special. So I just want to put this out there that if you do know someone and they have been diagnosed with trigeminal neuralgia, give them a little leeway. Don't try to compare it to something you have, because of all the things I've had, I couldn't compare it to any of those ever, and not even a migraine. And if you look at it on the scale chart, it is way up there, like second most of painful disorder. In fact, when I went into my neurosurgeon and decided we were going to do the surgery, we didn't see the blood vessel in the MRI, but he said, your symptoms, we can fix it. So he went ahead and did the surgery, which I'm glad, because he found it and there it was. He hurried and got me in because of the pain. He didn't want me to have to suffer any longer than I already had. So give those people a little leeway. Try to understand that you're not going to be able to see it. It doesn't compare with your headache or your earache. For some of us, yes, it has the nickname that it does for a reason. And I can tell you this, there were times that it crossed my mind, do whatever I needed to do, just make the pain stop. Just make it stop. And even after surgery, the PTSD is real. I can get a little flare and it pretty much terrifies me of what is it coming back. So that's what we got for you today. Thank you guys. I know I've been holding it. This is not my normal video. It's not something I usually do, but wanted to put it out there for all my trigeminal neuralgia warriors. You hang in there. We are hoping that each and every one of you not only can get diagnosed, but can find a better way than just overloading your body with more and more drugs, because I know your body gets used to them and all they do is up and up and up those medications. I'd like to see them find something better so that when you're like me and you have the surgery and you're coming down, you're going to be able to stop the medications. You don't have massive withdrawals. You don't have all that. There's got to be a better answer for this. And more neurologists and doctors need to be aware of it. They need to understand that what Google says is not the be-all, end-all. It is not. If I could have given this to a neurologist for a day, I would have. They would have had a whole change of heart on how they deal with people. We also need neurologists that don't want to just give you drugs and keep you on that money train of coming in. We need neurologists to step up and send you to neurosurgeons that can maybe help you, to send you to people that can get help. If they just want to feed you drugs, that's bad on them. I understand it can get you through to the next day, but there's got to be a better answer. And the only way we're ever going to find that answer is for the right people to come out with it And maybe then people will step up and do their freaking jobs and not just push medication or tell you it's all in your head. They'll step up and find out about it and figure out how to help you and possibly save a life. So there you go. Thanks for watching. Sorry to go on about a disorder you've probably never heard of, but this is what we're supporting today.